everybody, and welcome back. This is part 3 of our pregnancy journey. It's 10 videos that we're going to do. And if you missed last week, we talked about things you might want to consider when you're thinking about starting a family.
Yeah.
So go and watch that if you missed that. And just a reminder of who we are. I'm Christabel Samy. I'm one of the GPs in Rockingham.
And I'm Norafiah. I'm the midwife here.
Midwife extraordinaire. And just a little medical disclaimer. Obviously, we're giving you lots of information, but it's all general information and not designed to be specific for everybody.
No.
So please, if you've got any concerns, make sure that you use these talking points to talk to your own GP, midwife, and health professionals to make sure that it's applicable to you and your family.
Absolutely.
Right?
Yes.
So let's get cracking. So now we're so last week we weren't sure we were going to have a baby.
Yeah.
Then you and me, we decided to do the dirty deed. We have the baby. All right. Now what? Because you're preggers.
Exactly.
Right?
And sometimes it could be that completely unplanned, unexpected, or if it was fantastic and you're like, woohoo, now we're pregnant. And then now what?
But then how big is the baby? I feel like that's what people kind of want to know. Like, you know, when you're just early pregnant, you know, what's the baby look like? Grapes? I Googled this just to see what people get when they Google. Not even joking, we Googled it together. We Googled it and it came up with, your baby is a California roll. Your baby is a blueberry. Your baby is a grape. So we thought we'd give you some facts, medical facts. So the baby is like...
So this is in the first trimester. So the first trimester is usually like week 1 to 13 roughly.
Yeah, 1 to 13 because it's split up into trimesters.
In trimesters.
Because people might not know that.
No, that's true.
Because you haven't had a baby yet.
That's right.
So the baby is what, about anywhere between at the end of the trimester up to 10 centimetres.
Yep. Or the size of an egg.
Size of an egg, yes, that's a good one.
Yep.
And we weigh sort of 28 grams, so very, very small.
Yep.
And that's where all of the critical development occurs.
Yeah, so in the first trimester, exactly. So apparently, in one of the books that I read, the heartbeat kicks in at around about day 22. So by then you're what's that, about 4 or 5 weeks?
Yeah.
So and most of the times in the first trimester, most mums are sort of not really aware that they're pregnant. And so even though it's like it's a critical time in terms of organs forming or whatever, but don't stress, like don't stress about it.
Because a lot of people have been drinking maybe alcohol, they haven't taken their, pregnancy supplements or their folic acid. So we do, as soon as you find out you're pregnant, the recommendation would be to start folic acid. And the reason for that is that's when the spine is developing and the brain is developing. And to prevent something called spina bifida, which is a problem with that, we know that extra folic acid in the first trimester is really helpful. So that's the reason as soon as you find out you're pregnant, we would encourage you to take some folic acid to make sure you do that. But don't stress if you've not started it or anything like that.
So once you find out, basically, like if you've been having crap diet or whatever, just start making those changes, basically, to your diet.
And if you're smoking, that's when you should maybe go into your GP or nurses and start talking about how you can reduce that and stop. Because it's all about trying to reduce risks and things like that.
Yeah, so exactly.
It's good to have that convo.
Yeah.
And then, so that's basically how big the baby is.
Yes.
So not very big, size of an egg, that's all you're carrying. So you can't start eating for 2 yet.
No, that's right.
It's only an egg size, people.
So the baby's head is bigger than its body at the minute. And then the umbilical cord starts to circulate the blood and nutrients. So
and keep baby going.
Eating is passing through to the baby. The sex organs are now distinguished. But not yet complete. Eyes are closed, and there are starting to be like the baby's ribs and spine are also starting to like harden into bone, which is again why the importance of having the folic acid as well.
And also that's the reason why we didn't talk about that when you're planning to thinking about getting pregnant, but certain medications that the lady or the man may be on, sometimes your specialists might say if they're funky medications, wait a few months before you get pregnant. And that's actually the reason, because that's when bones and teeth and stuff are developing. And that's some of the medication does affect that particularly.
So then in terms of like what you're experiencing, so you may just notice that you're a little bit bloated or there may be some substantial weight gain. Usually it's quite, like it's a little bit more than, you know, what your normal weight would be.
Yeah.
That you kind of feel like you put on a little bit of weight.
Women normally know, actually, because their boobies get a bit tender, I think. I've not had babies, but that's what is told to me. Because that actually prompts a lot of women to take a pregnancy test, I think. Because I see a lot of women who say they feel really, really tired.
Yes.
Really, really tired and exhausted when, you know, they normally crack through the day. So that's probably fatigue is a symptom, I think.
Absolutely. And you could have changes in your bowel habits as well. And some women experience the nausea and vomiting. So again, that's probably another symptom, a common symptom where women go, oh shit, I think I might be pregnant. So
and the one thing we talked about in advance of this video that we really wanted to talk about also was it is common to get bleeding.
Yes.
And probably whenever people see blood and you're, especially in the early stages of pregnancy, I think everybody freaks out to one word.
Yes. Yep.
The M word.
The M word.
Miscarriage. Yeah. Everybody worries about that. Yes, that may be a sign of miscarriage, but actually we know that there is a lot of bleeding in early pregnancy.
Yeah.
We don't always know why.
No.
It doesn't always mean that the pregnancy is not progressing well or that there's going to be any issues. Yeah. I particularly have had ladies come in and they've been bleeding and we've done ultrasounds and investigations and tests and baby is doing absolutely fine.
Yeah.
So don't freak out if you do get bleeding, but you should go and see your doctor as soon as you can so that you can get checked.
And usually would the woman be sent for an ultrasound then just to kind of see what's happening?
Yeah. So, I mean, obviously our advice is really for Australia, but that would be the common thing that they would do in Australia, and I used to work in England. You'd come and see your GP. If it's out of hours and you can't get in with your normal GP, it would be to go to the emergency department or accident emergency, especially if you're getting pain and things, because we need to work out if things are going okay. We want to make sure you're okay and there's not a pregnancy in the wrong place or anything bad like that. Yeah. So make sure you get an appointment with a health professional as soon as you can.
Yeah.
But don't get really stressed.
Don't get stressed about
there are lots of things that aren't just miscarriage.
That's right. That's right. So, and then, and I guess at this time when you find out that you're pregnant, it's like getting your head around it if it was unplanned. And also choices, like where are you wanting to have this baby? So you might want to think about, well, apart from the obvious, you know, going into your local hospital, but there's also like the family birth centre here in Perth, near King Edward.
Yeah, you might have a home birth. So we have a lot of women who do that public or private. Yes, so if you did it publicly, there are certain rules and restrictions depending on where you are in terms of catchment areas. So we're talking about Western Australia specifically here.
So in Perth, I think there's the Community Midwifery Program, which is a fantastic program. It's publicly funded. Home birth, but the girls, they can also do what's called domino birth. So which means that you can have a midwife. So say midwife, continuity of care, but you're choosing to birth into a hospital, and so that midwife would also go into
the hospital with you.
Yeah, which is brilliant. Which is great. Yeah.
So there's loads of choices. So I guess as well, so this bit is mainly going to be for Western Australia or Australia. Yes. So take some of this advice with a little bit of thought of where you are.
Yeah.
So the big things that I get asked is public or private.
Yes.
And a lot of that probably determined by if you have private healthcare.
Yes.
Because if you don't have private healthcare, private might be very, very expensive with a private obstetrician.
Yeah.
Some of the things that women say is they like the fact that they're seeing the same doctor. Yeah. They know that doctor is going to be on call for the delivery and will be there.
Yeah.
So a lot of women, that's the main benefit. You get a nice private hospital room. I hear they've got room service now.
They do. It's like
a
hotel.
Yeah, so that's the fancy option.
Yeah.
There are a lot of women though who pick public options as well. And I have to say, as from a GP point of view, the public options for giving birth in Western Australia are very, very, very good.
Yes.
You get incredibly good outcomes.
Absolutely.
There's a lot of women's choice in it. And I've seen very positive experiences from that as well.
Yeah.
So as part of public, you might, do the community midwifery program, domino program.
Yep, a private midwife. So a lot of the reasons why, like women might choose, say, the family birth centre, community midwifery, or an independent midwife is to get that continuity of care, which just means you just see like a midwife all the way through. It's the same person, or a team of midwives as well, which is always handy because you don't feel like you're in a system where you've got to explain yourself every time you see somebody.
Yeah.
That's always important. But and just like in my experience, because I've worked as agency in the public and the private system, a lot of our public hospitals here are like excellent. The staff are like really, really good. And if it's just been a normal, straightforward vaginal birth, most of the time women just want to have an early discharge.
Yeah. And
just go home, the comfort of their own home, and then they get a follow-up with your...
I'm just going to make sure the screen hasn't gone off. Keep talking.
Yeah, with the hospital
being black.
That you'll get the follow-up with the midwife at home, like at the visiting midwifery service, of course, yeah. But, like, explore the options, like... and
also, we haven't looked at... the birth support people.
The
concepts of doulas. Yeah. So some women say, look, I want to have a baby in the hospital, but I don't feel like I, will be confident enough during the delivery to kind of make sure my birth plan is being actioned and I'm, getting the right sort of thing. So sometimes a doula would come in very handy there because they will have known you before to know where you're sort of heading, what your thoughts are, what your belief systems are, and they can sort of support that.
Your birth plan or your birth preferences. So, like if you don't want to have an epidural as an example, but you want to be, because we all know pregnant women in labour, they're very vulnerable, they're very suggestive. You can say things like, yes, of course, because they're in pain or whatever. But for some women, it's really important they step through like pain relief options.
Yes. And
so if you don't feel, or if your partner doesn't feel like they can speak up for you because obviously you're labouring, then a doula can, they come with a lot of tricks.
Yeah.
Yeah. So a lot of comfort measures, and they can talk you through stuff, or they can advocate for you. In the hospital to make sure that your preferences
are stuck to.
Yeah.
So we've had a lot of women go through doulas.
Yes.
And also in Western Australia, you can see your GP as well and deliver in the public hospital.
Yes.
Which we find a lot of women pick that. In my experience, a lot of women pick that, especially if they already have a good relationship with a GP.
Yes.
Maybe we've helped you with fertility struggles or your mental health before. It's a little bit comforting, I think, to see the same person that knows your history.
Yeah.
And even just going to the practice. So I have a lot of second and third time mums where the other children and partners and stuff and mums and dads and grandmas and grandpas already come here.
Yeah.
So they like the environment, and there's something comforting for them to know that they're just going to the local surgery to see the local family team and get their care there.
Yeah.
So that's an option where, like, they call that shared care. So wherever you are, there'll be a concept of shared care where you can see your own GP.
Yeah.
And the GP might do all of the care by themselves, and then you would deliver at the hospital local, public hospital.
Yep.
Or in my case, in a lot of cases, a GP will get an amazing midwife to work with them to assist with some of that, just so that you're getting all of the time, especially, as we progress through pregnancy, for your questions to be answered and, things to be done. Yeah. It can sometimes be a little bit hard as a GP to keep up with it all.
Oh, absolutely,
And then you've got two sets of eyes.
That's right. And there's certain things that, like a GP, like yourself, Christabel, are more aware of or have an understanding particularly in terms of like the medications you might be on, or, some of the conditions. Which as a midwife I wouldn't. I don't have, that's not my area. Whereas I cover more of the midwifery staff, and it's more, I suppose it's the soft skills.
Are you trying to say I'm the mean one? No. I'm not the mean one. Good cop, bad cop. Right. Good cop, bad cop. It's like we're parents. We may as well have a baby now. But midwives are, a little bit nice. I'm quite a nice doctor, so I am going to keep my mouth shut. But you might not maybe have a doctor that is a chataholic like I am.
But I'm like, I kind of, I help you track like, how the baby's growing, how to feel your baby, have a listen, that sort of stuff.
Yeah, exactly.
Talk about the diet and just spend a little bit more time on specific things related to pregnancy.
Yeah. And so that concept is called the shared care concept.
Yeah.
And I think that's broadly speaking, we don't want to give you too much information, but broadly speaking, think public or private.
Yes.
And if it's out of either of those, it's do you want a private midwife or a private obstetrician?
Yes.
Do you want a home birth?
Yes.
Do you want the domino birth?
Yep.
Do you want the community midwifery? Oh, that's the home birth, sorry. Community midwifery.
Oh, a family birth centre option.
Birth centre.
A doula to support you. And so that's whether you have a private midwife or not, but a doula will just attend to you like wherever you choose to birth.
And then there are also GP obstetricians who will also be able to assist in antenatal care. So it's about finding out your options, researching them, having a read, chat with friends, see what experiences people have had. Locally, people will always be able to say, oh, I went to this doctor, or I went to this midwife and she was fabulous or amazing or whatever. Or he.
And definitely shop around, because it's a really important journey. And people spend like, thousands of dollars on like a wedding or whatever, and they put a lot of energy and time, right? To research and like to get the best. So
you've got to do the same.
This is
and even if it's private and you're going privately, you do have a lot of options, and you do need to advocate for yourself and say, look, if you don't want to have a Caesar unless it's absolutely necessary, you've got to champion that. And just because you're paying money doesn't mean that you have to just take everything that is offered and said to you.
So
you can just...
you've got to find like a birth team that supports your choices, and you should be leaving every appointment feeling good about the choices that you made. And you should be feeling like you were given choices.
And feeling like it was a worthwhile appointment as well. Because I know some people that said they were like, it was pointless. Like, I saw the doctor or the midwife for 2 minutes. And they went, yep, are you all right? Checked my wee and that was that. And really it's more about, there's much more involved in that. So you need to have people that you feel comfortable asking questions to and are spending the time with you. The other thing that we should probably mention, and I think we forgot about this slightly, is towards the end of the first trimester, you do get some options with screening. And there's a couple that you would need to do before you went into the second trimester if you chose to do it. So we do screening in lots of ways. So we screen even by doing your blood pressure, okay? We screen by doing a whole lot of blood tests to check your blood group and things like that. But you will be offered more intense screening. And when I say that, that's the form of a blood test and an ultrasound, specifically looking for chromosomal problems. So that might be like Down syndrome, which is one that everybody will probably have heard of and be aware of. And that's done between sort of 10 to 12 weeks. So it's important that you think about whether you want to do that. In Australia, that is not necessarily covered by Medicare, and it's actually a private option, so it means a little bit of dosh. And there's a couple of money options. So it's to have a chat and think about whether you want to do it.
And just be aware that they are screening tools, so it just kind of works out your risk. It
doesn't tell you yes or no.
It doesn't tell you that's a definite yes you're going to have, the baby's got chromosomal issues, because to do that, that's a more invasive diagnostic test. And
what I always say is, so I've had some women over the years who have said, no, I wouldn't do screening because it wouldn't change whether I progressed with a pregnancy. So discussions and questions to talk to partners about is, would it change the pregnancy and whether you continued? Even if it wouldn't, would it be helpful for you to know so that you're prepared? Because you maybe don't want your initial reaction to be shock or upset, or that wouldn't be nice. And could you preempt that maybe? So some women like to know, even if it wouldn't change, whether they progress with the pregnancy, just from a knowledge and expectation point of view.
Exactly, and then knowing the support services you can call upon and for the care afterwards.
And also I have had some women who have been very sort of, I wouldn't do screening, but actually one lady I saw many years ago in a different country, she would have had a baby who had very significant chromosomal problems through the screening process, and unfortunately it became more of the baby might really face a lot of struggles. And so, there's lots of arguments for and against screening. It's not one size fits all. You really have to discuss it with people.
You have to make that informed choice. Work out like the risks and benefits, and whatever you decide to do, you have to feel good about it. And the decisions like that is always going to be hard to make anyway. So you're going to make sure your partner's on board. And
unfortunately, in Western Australia, it's a financial decision as well for some women. Unfortunately, because it is not covered by Medicare in Western Australia. But also, it's just giving you a risk, and then if you were to come up with a higher risk, you would be offered. But again, you don't have to have a definitive test, so that's to tell you yes or no. And that would be a little bit more invasive. So some people really think about whether they would do that and go down that line.
Exactly.
So those are the things that you would be heading up to between 10 and 12 weeks.
And then at this point as well, normally most women probably don't start to see a midwife I mean, you can see midwife at any point really, but most women generally tend to wait until they've had all their booking bloods and maybe at least the first 2 scans or something.
Yeah.
Before then they start booking in, but we're pretty flexible here, so you can come and see me whenever you like.
Well, sometimes you might want to see if they like to date you first.
Absolutely.
They don't want to commit.
Absolutely.
Men and commitment issues. Not that I know anything about that, people.
I have commitment issues.
So yeah, you might not want to commit straight off the bat. You might need a couple of dates.
Yes.
To see.
Yeah. Get a feel.
You know,
Like I said, shop
Is
around.
it her? Is it me? I don't know. It's not quite you. Anyway,
Right.
we digress. This has been a long video, even for Christabel and Norafiah standards. The computer keeps telling us to try to close off. So we might make this 2 parts, but we'll talk about that later.
Yeah.
So that is the end of our video. Next week we're talking about the second trimester. And do us a favour, give us a like, comment if there's anything you want us to be including in these videos, and subscribe to our channel so you can watch next week's video. Yeah.
Good
Good night.
night.
Bye-bye.
Bye.